Hi everybody and welcome to the Big Ideas Theater. I'm your host Ed Highland and I'm joined now by Kim Wiles, who'll be talking with us a little bit about portable oxygen concentrators and how they affect patients. Thanks so much for coming by and joining us. As we were discussing just a second ago, I don't know a whole lot about them, so maybe you could kind of fill me in a little bit on oxygen therapy and delivery, and also, of course, what's important here in Congress, what respiratory therapists should know about them.
Okay. Well, oxygen delivery is a little bit different when you get into the home. In the hospital, you're looking at continuous flow oxygen. In the home, we do what we call pulse delivery or bolus delivery, which means the portable oxygen concentrators, to allow for portability for patients, will deliver a bolus of oxygen just during inspiratory cycle. But it varies, so each unit will have different sensitivities, each unit will deliver a different bolus size, so you really have to understand that particular unit and how it will match to your patient and their lifestyle.
Give us some ideas of the limitations as you were getting into
Yeah, so
here.
some of the limitations are they're little portable concentrators that make their own oxygen and they store oxygen. So they have limited space for reservoirs. So they can only hold so much oxygen and only can make so much oxygen in a given minute. So if the patient has higher requirements for oxygen, the unit may not work for them. If they have lower requirements, any unit may be fine for them. So the amount of oxygen they can make is one of the limitations. The sensitivity on how hard the patient has to work to initiate a breath to get it, and then the weight and how heavy they are.
I was going to ask how difficult it is to actually, I'll say, train the patient. In other words, there's a learning curve there on how to properly utilize it.
There is. I think the learning curve is really, we need to translate to our patients what the differences are, because every patient wants to go online and buy a unit that weighs 4 pounds and it will last 36 hours, and they just don't exist. And so we really have to educate our patients that the limitations are the liter flow, the oxygen requirements, the durability, the sensitivity, the flow rate. You know, there's a lot of things that we need to take into account.
That comes into the last question I was going to ask about the advantages and disadvantages. Could you also get into the issue that we discussed just before going on about travel, utilizing it perhaps on an airplane? That
is probably the biggest advantage the portable oxygen concentrator advent has come into play, because it allows our patients independence and freedom. Every device pretty much you can take on an airline, which is great for our patients. But again, it goes back to, we still have to understand the limitations of that device. So just because it's in a 5-pound package, it might not work for every patient. They may need the one that's 10 or 15 pounds. But that is probably the biggest advantage to patients, because it allows them their independence.
What do respiratory therapists need to know that perhaps they don't yet know?
I think they need to be able to advise their patients on how to choose, because with the advent of the internet, patients believe that they can buy it on the internet and they don't understand the limitations. I can tell you, whenever you go and do a Google search, they are not targeting the patient, they're targeting, it's a marketing campaign.
Sure.
So we really need patients to understand what these limitations are before they go out and buy these devices, because it may work when they first buy it, but as their disease progresses, it will not keep up with them, and they've just spent a lot of money.
Great advice. Thank you, Kim Wiles.
Oh, you're welcome.
Tell us about POCs.
Thank you.
And this is the Big Ideas Theater, sponsored by Draeger.